Welcome back to this special edition of Hardball. U.S. Congressman Darrell Issa of California is the ranking Republican on the House Oversight and Government Reform Committee. Congressman, thank you for coming back tonight and sticking around. We heard Jim Clyburn, the Democratic whip, who basically confirmed the fact that the plan for the Democrats now to get health care through is the House to pass the Senate bill, the Senate to reconcile through the reconciliation measure the problems the House has with the Senate bill and the public, quite frankly, has with it, and to fix the bill in a two-step. What will your side do?
Well, Chris, I'm from a state where it takes a two-thirds majority in order to do budgets or tax increases. So, I'll go back home, and I think most Republicans will go back home and say the democratic tradition of the Senate has been violated in this process. But even if you get past that, and I don't have a Frank Luntz moment here, I think what we have is we have a failure to see that the compromise that they're proposing is no compromise except among themselves, and the compromise that maybe Massachusetts told us, or certainly the American people told me last summer, is the one that's not there. And it's a shame. Today was a lost opportunity, and I think Republicans came prepared to hope for a compromise that they didn't see happen.
Well, that sounds like a strategy of basically complaint. Is that it? Do you recognize that they have the numbers? Do you recognize they have the numbers to do what I described it looks like they intend to do?
Chris, I ran for the Senate and lost, but I've always respected the fact that the Senate was a democratic process. It was a process in which everyone felt that they didn't have a vote when people didn't understand things. They didn't ever rush the judgment. And in fact, I think that there are a lot of good things there. Serving in the House, sometimes both sides have been guilty of it over the years. Sometimes basically they throw something in at the last minute and you report on it weeks or months later, all the things that we wouldn't have voted for if we'd known were in there. In this case, it's very clear that there are lots of easy gains, easy things we could do. We passed something out of the House, overwhelmingly bipartisan yesterday, that stripped away the limited antitrust exemption for health care insurance providers. That was a good idea of something that, although not universally liked, could be voted by two-thirds plus. I have a bill, H.R. 3438. All it says is, let's open up the system, if you will, the public option of letting people into the system that members of Congress and members of the federal workforce are in. Easy enough to do. Put it on the floor. It will pass in the House and the Senate. There are dozens of things like that that would be confidence builders. And, you've followed more than just politics. You've followed the Middle East peace process. You've followed a lot of places in which you look and say there's so little trust or so little ability to trust that the outcome will be good, that what you have to do is prove a few things. I think the president should I really believe he should take a good chunk of this that can be passed with at least some Republican support and put it out there, get the confidence of the American people that incrementalism to the left or the right is probably in the American people's best interest. The healthcare system is not so broken that you must do all at once, even though the American people know, and Republicans had better start saying this in what we do, it is broken enough that it needs to be fixed, but it doesn't necessarily need to be fixed all at once. Let's do what we can agree to do. That's what we didn't hear today from either side.
But the president said it in concluding this session today, and I heard what you said, and it has great validity, but the president said today in ending it, there's a fundamental difference between him, his party, and your party. That is to cover the 30 million people that are not insured right now. Does your party have a plan to do that?
Well, I don't speak for my party. I do speak for the 49th Congressional District. I can tell you that if we had a bill before us that said we would augment in all 50 states people who could not afford insurance through a means testing, we would come up with a scheme to augment them, like we do with S-CHIP and some other areas. That concept would fly through my district look, as long as they really can't afford it, we're willing to help, and those who can afford it should be told they better buy it and stop going to emergency rooms and saying they have no insurance.
Have you run that by John Boehner?
I have, and John Boehner is supportive that the poor need to be taken care of. Now, in fairness, unless we come together on a bipartisan basis, we're not going to work out the nuances of what can work. Unless we get doctors and hospital executives in and insurance companies, we're not going to come up with the most cost-effective way to do it. But at the same time, you know, both sides should admit that we need to deal with the fact that our health care costs, insured or uninsured, is escalating and being less affordable while other countries are coming to grips with it. We have to do that too.
You know, it's just the problem is that I've watched this for years, as you said. For 30, 40 years I've been watching politics, and I've never seen the Republicans, with the exception of Richard Nixon back in the 70s, really come out for a plan to provide health care for all the people that don't have it. But I accept the fact that you would do it. So, Congressman, thank you very much. Darrell Issa from California.
Thank you, Chris.
Thanks for joining us and staying around tonight. We'll be right back with much more on the strategy of today's health care summit. This is a special edition of Hardball.